Aminophylline. Aminophylline is used to prevent and treat wheezing, shortness of breath, and difficulty breathing caused by asthma, chronic bronchitis, emphysema, and other lung disease. It relaxes and opens air passage in the lung, making it easier to breathe. This medication is sometimes prescribed for other uses. Aminophylline comes as a tablet and syrup to take by mouth and suppository to insert rectally. It usually is taken every 6, 8 or 12 hours. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take aminophylline exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Take the tablet or oral liquid with a full glass of water on an empty stomach, at least 1 hour before or 2 hours after a meal. Do not chew or crush the long-acting tablet. Swallow them whole. Aminophylline controls symptoms of asthma and other lung disease, but does not cure them. Continue to take aminophylline ever if you feel well. Do not stop taking aminophylline without taking to your doctor. To insert a rectal suppository, follow these steps. Remove the wrapper. Dip the tip of the suppository in water. Lie down on your left side and raise your right knee to your chest. A left-hand person should lie on the right side and raise the left knee. Using your finger, insert the suppository into the rectum about half to 1 inch, 1.25 to 2.5 centimeters in infant and children, and 1 inch, 2.5 centimeters in adult. Hold it in place for a few moments. Stand up after about 15 minutes. Wash your hand thoroughly and resume your normal activity. Other uses for this medication. Aminophylline is sometimes used to treat breathing problem in premature infant. Talk to your doctor about the possible risk of using this drug for your baby's condition. What special precautions should I follow before taking aminophylline? Tell your doctor and pharmacist if you are allergic to aminophylline or any other drugs. Tell your doctor and pharmacist what prescription medication you are taking, especially alpurinol, azithromycin, carbamazepine, cimetidine, ciprofloxacin, clarithromycin, diuretics, waterfills, erythromycin, lithium, oral contraceptives, phenytoin, prednisone, propranolol, rifampicin, tetracycline, and other medication for infection or heart disease. Tell your doctor and pharmacist what non-prescription medication and vitamin you are taking, especially non-prescription medications containing ephedrine, epinephrine, phenylphrine, phenylphenolamine, and pseudoperidine. Many non-prescription products contain these drugs. Example, diet pills and medication for cold and asthma. So check label carefully. Do not take these medication without taking to your doctor. They can increase the side effect of aminophylline. Tell your doctor if you have or have ever had seizures, heart disease, and overactive of underactive thyroid gland, high blood pressure, or liver disease, or if you have a history of alcohol abuse. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while taking aminophylline, call your doctor. Tell your doctor if you use tobacco product. Cigarette smoking may affect the effectiveness of aminophylline. What special dietary instructions should I follow? Drinking or eating food high in caffeine, like coffee, tea, cocoa, and chocolate, may increase the side effect caused by aminophylline. Avoid large amount of these substances while you are taking aminophylline. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed dose. If you become severely short of breath, call your doctor. What side effect can this medication cause? Aminophylline may cause side effect. Tell your doctor if any of these symptoms are severe or do not go away. Upset stomach pain, diarrhea, headache, restlessness, insomnia, irritability. If you experience any of the following symptoms, call your doctor immediately. Vomiting, increased or rapid heart rate, irregular heartbeat, seizures, skin rash. If you experience a seizure side effect, your doctor may send a report to the Food and Drug Administration. What should I know about storage and disposal of this medication? Keep this medication in the container it came in tightly closed and out of reach children. Store it at room temperature and away from excess heat and moisture, not in the bathroom. Unneeded medication should be disposed of in special ways to ensure that pets, children, and other people cannot consume them. However, you should not flush this medication down the toilet. Instead, the best way to disposal of your medication is through the Medicaid Take Back program. Talk to your pharmacist or contact your local garbage recycling department to learn about take back programs in your community. See the FDA's Safe Disposal of Medicine website. It is important to keep all medicine outside and reach of children as many containers, such as weekly pill minders and those for eye drops, creams, patches, and inhalers, are no children resistant and young children can open them easily. To protect young children from poisoning, always lock safely caps and immediately place the medication in a safe location, one that is up and away and out of their sightly and reach. In case of emergency, overdose. In case of overdose, call the poison control helpline. What other information should I know? Keep all appointment with your doctor and the laboratory. Your doctor will order certain lab tests to check your response to aminophylline. Do not change from one brand of aminophylline to another without taking you to your doctor. Do not let anyone else take your medication. Ask your pharmacist any question you have about refilling your prescription. It is important for you to keep a written list of all the prescription and non-prescription medicine you are taking, as well as any products such as vitamins, mineral, or other dietary supplement. You should bring this list with you each time you visit a doctor or if you are admitted to a hospital. It is also important information to carry with you in case of emergencies.